My name is Leia Hoggard, and I'm a public health student at Northern Arizona University, and I'm going to be presenting on maternal morbidity and mortality, expansion of telehealth. So, an introduction, maternal mortality and morbidity in the United States is the highest among other high-income countries. Several factors contribute to these outcomes, for example, the availability of healthcare workers, the social determinants of health, and geographical location. The availability of nurses, midwives, and physicians plays a critical role in reducing maternal mortality and morbidity in underserved regions by improving access to essential prenatal, childbirth, and postnatal care, addressing complications and outcomes, and reducing stigma surrounding the social determinants of health. So my research question is, how does the availability of nurses, midwives, and physicians influence maternal mortality and morbidity in underserved regions? So background, for pregnant individuals, it is recommended that appointments start in the first trimester and they should have them every 4 weeks within the 28-week mark, then every 2 weeks in the 36-week mark, and every week until birth after that. Around 2.1% of pregnant women have no access to prenatal care and 12.5% have inadequate care. The quality of healthcare that mothers receive is associated with racial and ethnic disparities. Health insurance is also a factor that impacts those who reside in rural areas and are affected by racial and ethnic disparities. Patients also found that due to their rural location, providers are not available and the care that they receive is very poor. And there are around 19 deaths per 100,000 births in the United States, and around 84% of these deaths are preventable. One main cause of death is no access to healthcare providers who help with prenatal and postnatal care, especially within rural areas. Healthcare providers also said that those who come from rural areas are harder to treat because of the lack of rural services and the specific pregnancy risk factors, so they cannot provide the accurate and proper care. The location is also a factor that affects maternal health, and all these areas lack all of this kind of care with healthcare professionals. The availability of nurses, midwives, and physicians plays a critical role in reducing maternal mortality and morbidity in underserved regions by improving access to essential prenatal, childbirth, and postnatal care, addressing complications and outcomes. So my proposed intervention is one of the most prominent interventions that has emerged is from new technologies is telehealth. Telehealth is a service that is provided to patients that allows them to connect with healthcare providers remotely and helps to address geographical barriers that have been an issue. Telehealth has also rapidly become a part of healthcare and provides efficiency, convenience, and accessibility. So objective 1 looks at increasing the number of patients who use telehealth consultations by 20% within the next 9 months by ensuring accessible services through medical providers and services, improving patient treatment and outcomes. Objective 2 focuses on expanding healthcare services like telehealth to underserved rural populations by increasing the number of new telehealth patients by 30% within the next 9 months through community partnerships and user-friendly technology, aiming to improve healthcare access and quality. The main activities is the first one is implementing technology setup and integration to maternal deserts. And the second is implementation in training healthcare providers to use and access technology. The third is implementation in patient education and engagement. So setting the detailed instructions and knowing how to set up the technologies for patients is important. So the implementation, the implementation will take around 6 to 9 months to get everything into shape. Technology setup will take around 1 to 3 months just to have technology accessible and available as well as fully set up. The timeline for the second activity will be 2 to 3 months. Training healthcare professionals to use and access technology may not take a long time since a lot of healthcare professionals do use it, but you want the training for them. And then trying to diagnose through a screen is difficult. So this last activity will take around 2 to 3 months. It seems short, but implementing regular monthly training is important for healthcare providers. And patient education and engagement varies because each patient case is different. So it'll take around 1 month for each patient to get everything set up. The evaluation plan is using a targeted population, which will be pregnant individuals, looking at health outcomes as indicators and pre and post surveys on those health outcomes. So the audience request is that resources that are needed are funding for internet services, possible devices for patients, and for health professionals who help out. Donations and funding for devices for patients is also important. Personnel is also needed, especially those who can set up the services for patients. And looking at how to provide internet services and building teams to help with these resources. Creating the plan to go to rural areas and deliberate and decide which community needs what, and some may need more help than others, and a few teams who are professionally inclined to help out with providing these services. Final takeaway is that in a country where preventable Preventable maternal deaths still occur far too often, particularly in rural and underserved communities. Telehealth is not just a convenience, it is a lifeline. By breaking down geographical barriers and expanding access to quality prenatal and postnatal care, telehealth can also be a transformative force for efficiency and better outcomes. The proposal is not only about implementing technology, it's about saving lives, empowering providers, and ensuring every mother, regardless of where she lives, receives the care that she deserves. The time is to act now because every mother matters. Here are my references.